Hi, and thanks for joining us today. We are going to talk about contact dermatitis. Contact dermatitis is also known as a type 4 hypersensitivity reaction. That's a certain classification of the type of allergic reaction it is. And type 4 hypersensitivity reactions are characterized by delayed reactions. So in this case, what we're dealing with is if something comes into contact with your skin, it may not immediately bother you, but it could bother you after some period of time, after a day or so. And so sometimes patients are referred to us because they have ongoing rashes. And what we do is we take a look at the type of rash, we assess whether it could be contact dermatitis and whether patch testing is indicated. So patch testing is what we do to figure out if you're reacting to specific substances. The patch that we use is called the North American 80 patch, and the 80 means that there are actually 80 tests on this patch. And they're all different kinds of chemicals that we look for. Substances that are in your everyday products that are coming into contact with your skin that could be triggering you and causing itching and rash. So an easy one is nickel. Everyone's heard of nickel, but then there are lots of different kinds of substances that have very many letters in them, like hydroxyperoxides of limonene, hydroxyperoxides of linalool, all sorts of, literally there are 80 different things that we test for that you could be coming into contact with that could be triggering a reaction. So other examples include things like balsam of Peru or fragrance mix or even gold. But overall, these substances are very common in products that you use, whether it's soaps, detergents, hair products, facial products, and we look for specific things that could be triggering you. The way that we do a patch test, it's actually done over several days. So what happens is the patches literally come on a sticker and we prepare them the morning that you're coming in. There are 10 tests on each panel and we put 8 panels on your back for a total of 80 tests. We will put the test on a Monday. Once the test goes on, it cannot come off till we take it off. So we put the test on, it's just paper tape, so you don't want to get the area wet. You don't want to take a shower, you don't want to go exercise and get sweaty because it'll fall off. You don't want to sit out in the hot sun because again, it'll get sweaty and fall off. So just keep it dry once we put it on. So we put it on a Monday, we leave it there the rest of Monday, Tuesday, Wednesday you come back in and we take the patch off and we read it. So we have a 48-hour read. Then you come back Thursday and we read it again at a 72-hour read and we see what you're reacting to. In some cases, if we're concerned that maybe you'll react even further, we'll do a 96-hour read. But in most cases, we do 48 and 72 hours in our office. And then we give you information about each substance that you're reacting to so that you can avoid those substances. And hopefully with avoidance of those products, your skin will improve. So that's the quick lesson on patch testing. If you're concerned about your rashes, if you think that you may be coming into contact with something that's triggering you, certainly let us know so we can look into that for you. Thanks for watching and be sure to subscribe to our YouTube channel.